friends, welcome back to my channel. So today in this video we are going to study about common normal anatomy which is seen on OPG or a panoramic radiography. So what is panoramic radiography? It is a radiographic procedure that produces a single tomographic image of facial structures including both maxillary and mandibular arches and their supporting structures. We all know that OPGs are so common in dental practice, right? But the correct knowledge and the anatomical knowledge of these structures on OPG should be accurate in our mind, okay? When we know what is normal, we could identify what is abnormal, as in this image, right? So let's study the normal bony landmarks on OPG first. Okay, so starting with bony landmarks in mandible. First, we'll start with condylar head. Okay, number 1, condylar head. It is a rounded projection of bone extending from the posterior-superior border of the ramus of the mandible, and it articulates with glenoid fossa over here, okay, of the temporal bone. Remember, glenoid fossa is structure of temporal bone, and on panoramic radiograph, mandibular condyle appear as a bony rounded radio-opaque projection, okay, extending from the posterior border of the ramus of the mandible. Then the second is sigmoid notch or coronoid notch, okay. It appears as a radiolucent concavity located distal to the coronoid process on the superior border of the ramus. Then third is your coronoid process. On OPG, it appears as a triangular radio opacity posterior to the maxillary tuberosity region, okay. Then comes the external oblique ridge which runs downward and interior from the ramus of the mandible. Then here you can see the ramus of the mandible, okay. On OPG, it can be seen and many structures can be shadowed over it, okay. Shadows of other structures may be superimposed over the mandibular ramus area. So what can be shadowed over this? Posterior wall of nasopharynx or pharyngeal airway shadow, especially when the patient is unable to expel air, okay. Then cervical vertebrae, okay, which are not well defined in this x-ray, but it can be present somewhere here. So cervical vertebrae, especially in patients with pronounced anterior lordosis, is seen in osteoporotic patients. Then earlobe or ear decorations can be superimposed in this ramus region, okay. Then here you can see the mandibular canal, okay, through which our inferior alveolar nerve passes, okay, and this is the posterior border of our ramus. Then comes gonial angle. It appears as a radio-opaque bony structure where the ramus joins the body of the mandible. Then here you can see number 8 is your lower border of the mandible, okay. Then there is this presence of mental ridge from the premolar to anteriors, okay, and from anteriors to again premolars of the other side. This is the mental ridge. Sometimes a radiolucent area is present above this mental ridge which is known as mental fossa. Then number 10 is your genial tubercles, okay. So genial tubercles appear as a ring-shaped radio opacity surrounding the lingual foramen. That is your genial tubercle. And what is lingual foramen? It is not well defined over here, but lingual foramen is a small radiolucent dot which is located inferior to the apices of mandibular central incisors. So there is lingual foramen also, okay, it is like a dot, and around it there is a opacity which is your genial tubercle, okay. So do keep in mind, in few OPGs you might find this thing and in few you might not, okay, it is variable, but do keep in mind that there is a structure called lingual foramen and genial tubercle in the interior region of mandibular anteriors. Then there is mental foramina. Obviously everyone must be clear with it, okay. Mental foramina below the root of first premolar to be precise. And then there is a presence of lingula, okay. Lingula gives the attachment to which ligament? Sphenomandibular ligament, okay. But it is not seen on x-ray, but the structure lingula is seen like a triangular projection. And lastly, hyoid bone, it is seen bilaterally in this region, okay. It is U-shaped radio-opaque body. It is just below or at the level of inferior border of the mandible. It might be at the level of the inferior border of the mandible, or it might be below the inferior border of the mandible. Now let's look at the bony landmarks in the maxilla. So there is a structure known as mastoid process, okay, mastoid process, which is not seen in this panoramic radiograph, but it might be the lateralmost end, okay, somewhere here mastoid process can be seen. It is a rounded radio opacity which is located posterior and inferior to your TMJ, okay. Here is somewhere our TM joint, so it is posterior and inferior. So basically in this region your mastoid process can be seen. Okay, so let's start with number 15, which is your glenoid fossa, okay, which is also known as mandibular fossa. It is a concave and depressed area of the temporal bone, okay, and it is a concave radio opacity superior to your mandibular condyle, as you can see. So here number 16 is your articular eminence. On the radiograph it appears as a rounded radio opaque projection of the bone located anterior to your glenoid fossa is articular eminence. Then comes the zygomatic arch, okay. Number 17 is your zygomatic arch. It is also a radio opaque structure. Then comes the posterior wall of the sinus. Number 18 is your posterior wall of the sinus, okay. Then there is a floor of maxillary sinus, okay. It passes from the root apices of premolars and molars is your floor of the maxillary sinus, right. Then comes the zygomatic process of the maxilla, number 20, okay. It is also radio opaque line, okay. Then the horizontal line which you see on your OPG are your hard palate ka line on both the side, okay. So it is your hard palate. Then orbit appears as a radiolucent cavity over here, okay, and here you can see the floor of your orbit. Then nasal septum is seen here. Number 23 is your nasal septum, okay. It appears as a vertical radio opaque partition that divides the nasal cavity. Then comes the incisive foramen in the region of maxillary anterior region. Then comes the incisive foramen in the maxillary anterior region between two central incisors. There is a presence of incisive foramen, okay. And there is also a presence of incisive canal. In few radiographs it appears as a tube-like radiolucent area with radio opaque borders. Then number 25 is inferior concha, okay, as you can see, and number 26 is your meatus, okay. Then somewhere here you can see the frontal process of zygomatic bone. It might not be visible in all the radiographs, okay, but when it is, you should be able to identify it. Then here is a presence of pterygomaxillary fissure. This is your pterygomaxillary fissure, okay, sharp triangular projection. Then somewhere here you can see the spine of the sphenoid bone, which is also a radio opaque structure, okay. Behind your second molar, or if third molar is present, you can see radio opacity, okay, or a thickening of the bone, which is your maxillary tuberosities. And lastly, lateral pterygoid plate, okay. It is winged shaped bony projection of the sphenoid bone, which is located distal to your maxillary tuberosity region, and on OPG it appears as a radio opaque projection, okay, of the bone which is distal to maxillary tuberosity region, which is your lateral pterygoid plates. Sometimes a pterygomaxillary fissure is also present. It is a radiolucent area between the lateral pterygoid plate and the maxilla. There is a radiolucent structure present which is known as pterygomaxillary fissure. Here are some of the other structures as we can see, okay. First of all, here you can see the external acoustic meatus, okay. It is a radiolucency surrounded by radio opacity is your external acoustic meatus. Then there is this sharp bony projection which is your styloid process, okay. And below it you can see the shadow of the earlobe which creates a radiolucent area. Then this region, it's a soft tissue landmark nose, okay, in this region. Sometimes the shadow of cervical spine is seen in this region very evidently. And then cervical vertebrae are present over here, okay. And nasopharyngeal space is here somewhere. This is your nasopharyngeal space. And this is the region of submandibular fossa on our OPG. So this was all about normal anatomical landmarks on OPG. I'll see you soon in the next lecture with some deformities, okay, and the common errors in OPG and how to identify them. If you like this lecture, if you have learned something from it, then please hit the like button and don't forget to subscribe it. Thanks for watching. See you in the next video.